Give us your, forgive the expression, prescription right now, how we are doing on this public health crisis. What are we doing that we should be doing? What are we not doing we should be doing?
Well, this is very much a public health crisis, and people are very worried about it, and there's an enormous amount of activity going on in response. And I think it's important to think about a couple different dimensions of the response. One is organizing the government and the private sector to do what's necessary to control the disease without devastating the economy and kind of shutting down in counterproductive ways. And so I think there's a lot of activity in that area. That you have local health departments that are mobilizing to track people. You have state health departments that are planning for where patients could go. The CDC is providing overall national guidance. I think that is proceeding because we have a lot of great professionals in all those different areas. There's another dimension to this, which is communications, and it's very important that there be clear and consistent communications because fear and panic always happen with public health crises. And here I think we get mixed reviews at the moment because we have multiple messages coming out of the federal government, different messengers, confusion about testing and other things. And I think it's really important, it's going to be very important for the long term, that the people that the American public are hearing from are people with credibility, with scientific backgrounds who can be trusted. And so I would like to see more of a consistent and competent communications effort.
Dr. Sharfstein, I'm so glad that you mentioned testing, because for us who are lay people, not really professionals in this, we can't quite understand why we're not testing more people, because it's hard to really address the problem if we don't know how big the problem is. And without testing, can we really know how many people, for example, have it in the United States of America right today?
Yeah, we do not know how many people have it because there's been some problems with the tests. The tests that the Centers for Disease Control created didn't really work out of the box, and we've been sort of playing catch-up ever since. The FDA issued a policy to try to rapidly scale up testing even before the agency could review the specific tests, and that's going to lead to a lot more testing availability, and hopefully will address this initial problem. But I think even though it's absolutely true we need more testing and we've had a big problem standing up testing, it's also important for people to understand that they don't necessarily need a test right now. There's a lot of sometimes thinking in this situation that if I just got a test, that could be reassuring. But the truth is, you know, with an illness that has a 14-day incubation period, you could get a negative test, and the next day you could get sick. So using testing wisely and really understanding the results becomes really important. Right now, I think the priorities for testing are people who are sick, who have serious cough, pneumonia, and no explanation for their symptoms. Anyone who is part of a investigation of a particular case, but people who just wake up and have no known exposure and are basically feeling fine and just wondering whether they have it, this is not the time to go to the emergency department. Number one, you don't want to crowd the emergency department, and number two, you don't want to sit next to someone in the waiting room who might have coronavirus. So it's really important to put texting in context, even as we realize we don't have enough right now.
Doctor, I want to interrupt us just for a moment now, because a red headline just crossed the Bloomberg that the World Economic Forum has postponed its Riyadh summit until next year. This is, of course, not Davos. This is the one they have in Riyadh. But the one in Riyadh now has been postponed until next year. Not the only one of these sorts of events that right now is being postponed because of the coronavirus threat. So, Doctor, let's come back and let me ask you, as a public health expert, we think of this as a medical problem, as a scientific problem. Is there also a socioeconomic aspect to it? That is to say, some of the people maybe most affected and least able to address the problem may be the poorest among us. And even, for example, with respect to testing, as I understand, these tests cost some substantial amount of money. I've heard $2,000 to $3,000. Most people in the United States, as we know, 40% of the country can't afford $400 for an emergency. Is there a socioeconomic danger here that actually it will spread worse among the lower socioeconomic classes because they don't have the wherewithal to deal with it?
Well, here's the thing. When it's an infection like this, it affects everyone. So if there are people who can't afford to get tested, or even worse, they can't afford to get treated and isolated, they have to go to work because it's the only way they can get money, then that risks everyone. You know, somebody who works in a restaurant, it's the diners who could be at risk. So it's really important for us to see this as everyone's in it together, and we really do have to help people who don't have financial means make sure they can get the testing, the treatment, and other economic support that they need. And that really does protect all of us.
Dr. Sharfstein, you said earlier that we may be playing from behind a little bit when it comes to the test kits. I don't know about other aspects of our response, but do you have a sense that we are catching up? As a country, as a government, particularly the federal government, are we catching up if we are playing from behind?
Yes, I think that in some respects we're catching up. I think in other respects we're doing, very well. I'm so impressed with the National Institutes of Health launching different kinds of studies right away, really in record speed, to try to eventually get to a vaccine or treatments that can save lives. I think that's very promising. But I do think that there's still some major question marks about whether the overall response is going to be led from a scientific viewpoint or not.
At the same time, we just had a political science professor, Professor Berkman from Penn State, on talking about the federal system of government. Is there a quality control potential issue here that you don't have, for example, in China? The regime in China and Beijing can decide what happens, and it happens. Here you have a federal government, you have got state, you've got local public health officials. Should we be concerned that there may be some disagreement or a failure to have consistency across the federal government?
Well, I think that that's both a strength and a weakness, but in many ways it's a strength of our system because I've been a local health officer. I was the health commissioner for Baltimore City here, and I'll tell you that local health officers are often some of the most trusted people in their communities. And if you're trying to reassure people in times of anxiety, having somebody, I would stand next to the doctors from Johns Hopkins, University of Maryland, other hospitals, and we would provide updates and information and reassurance and guidance on things like Ebola or influenza. And so it's the same people, it's people you trust in your community. So I think having that system where it's not just one person in the White House talking and that same message is amplified sort of robotically, but that people who are trusted in communities can really help their communities make it through this, I think that that will prove to be a strength for our system.